Intramedullary Nailing Principles, Part 2. An intramedullary nail's job is to keep the main bone fragments in the correct position while still allowing a small amount of controlled motion at the fracture site. That is why intramedullary nailing is a classic example of relative stability. But before we talk about stability, we need to understand reduction. Every fracture needs reduction before fixation, no matter what implant we choose: a cast, a plate, an external fixator, or an intramedullary nail. Reduction means restoring the overall shape of the bone. We do not want the bone to heal shortened, crooked, or rotated, because that can affect how the patient walks and functions. Now, how does an intramedullary nail work exactly? Imagine the bone as a hollow pipe. After the fracture, you now have two pipe fragments. Once the fracture is reduced, a metal rod is inserted inside both fragments. Because the nail sits inside the canal, it helps both fragments share the same central axis. It works like an internal guide rail. The closer the nail fits inside the canal, the more it helps control bending and translation. This is why nail diameter, canal fit, and reaming matter biomechanically. But if we only placed the rod inside the bone and did not add screws, the fragments could still slide up and down the nail, rotate around it, or lose length. So we add locking screws. The locking screws connect the bone fragments to the nail. So why is this still relative stability? Because the construct is not compressing the fracture surfaces together like a clamp. There can still be small motion between the fragments, small motion between the nail and screws, and small bending of the construct when the limb is loaded, and that is okay. In many long bone shaft fractures, we do not need perfect rigidity. We actually want a controlled mechanical environment that allows callus around the fracture. This is also why intramedullary nailing is often preferred for many long bone shaft fractures. It can stabilize the bone without opening the fracture site widely. Less soft tissue stripping means we preserve the fracture hematoma, periosteal blood supply, and local biology. That helps healing.